Thank you everyone for joining us this morning. As I said, please mute yourselves so that we don't talk on top of each other, and also put your questions on the chat. Today, we will be talking about a subject that everyone is talking about and probably everyone is suffering with, but don't know. So today we are joined by Dr. Neil Forrest from Osler Health International. Dr. Neil is a very good friend of ours, and he's been on our talks before talking about mental health. Hi, Dr. Neil, how are you?
Hi, Susan. I'm very well, thanks. Thanks for having me back.
You're most welcome. So should we start? I know you have a couple of slides to show us, so let's go through that, and then we'll go through questions as we go along.
Okay, no problem. So I wish I was there giving this talk in person and people could interrupt me as I go along. So do your best to ask questions as they come up. You don't need to wait till the end of the talk, just put it into the chat. And then Susan, if you can interrupt me as needed as we go along. I prefer to do it that way if we can. I'm just going to share my screen. Assume that's working. Yeah. Great. So as Susan said, my name's Neil Forrest. I'm a family doctor in Singapore. I've been here for, I think this is my 7th year now. And I've been asked to talk on this, this topic this morning. I think a lot of people feel that this is a COVID pandemic phenomenon. And the truth is that we were seeing lots of people with anxiety or panic symptoms long before COVID came along. But there's no doubt that the situation around the world has exacerbated things in recent months. So first, I'm going to talk a little bit about what anxiety is. It's a difficult word, anxiety, because as well as a medical diagnosis, anxiety disorder, it's also a word that we use in everyday life. Most of us know what it feels like to be anxious and would describe feelings of anxiety on most days. So that can be problematic. You know, when I talk about diabetes, people who don't have diabetes don't think they know how that feels. Whereas with anxiety, everyone kind of thinks they know what anxiety feels like, but it comes in many different forms. At its heart, anxiety is a very intense, persistent worry that's often very excessive in relation to the situation. Some people get anxious about very anxiety-inducing things like significant life events, but lots of people get anxious about everyday situations. And I think we can all recognize either in ourselves or in someone we know that person with an anxious personality type that tends a little bit towards worrying about stuff rather than letting it go. When we talk about anxiety in medical terms, sorry, I'm just trying to make my slide move on. There are different types. These are the main ones that are recognized by the World Health Organization and the diagnostic authorities in America. You can see them all there. I'll go through them very briefly and just explain what each one is, but please put your hand up if I'm not clear. So a generalized anxiety, something I see really commonly, a day-to-day feeling of heightened stress and anxiety all the time, often not triggered by anything in particular. People describe feeling on edge, feeling that the worries take over their thoughts and they start to feel worried about feeling worried. In some people, that can progress in its more extreme forms to panic disorder. So the topic of the talk today is anxiety and panic attacks. I'll talk about panic attacks in a little bit more detail later. But they are a sort of separate entity to generalized anxiety, despite the fact that there's a lot of overlap. Social anxiety, I think we can all relate to that to some degree, can't we? But social anxiety is an anxiety around specific social situations or interactions. And that can be helpful in its milder forms, but extremely damaging when it starts to take over. The anxiety that many people who don't have generalized problems will experience in day-to-day life is specific phobias. So most of us will have something in life that induces a state of panic or fear in us. For me, it's heights and tall buildings, and to a lesser degree, things that crawl around like cockroaches and rats and mice. But everyone's got their own version. For me, my specific phobias are easy for me to avoid. For some people, they can be incredibly damaging and incredibly restrictive on their lives. There's a little bit of overlap between agoraphobia and specific phobias. Agoraphobia describes an anxiety that relates to the need to escape from a situation. For some people, I think in day-to-day language in English, we often use agoraphobia to mean a fear of crowded spaces and lots of people. That's one form of agoraphobia, but some people have agoraphobia where they're frightened to leave the home, where they're frightened of enclosed spaces, so like a claustrophobic experience. And some people get agoraphobia in open spaces. So some people really struggle to handle the vastness of open spaces, and that's a type of agoraphobia as well. And then the final one on that slide is separation anxiety. That's not just feeling unhappy when someone you love goes away. I think that's a normal human condition, and I wouldn't call that a medical problem. But in some people, there's an intense fear and an intense worry about separation, about saying goodbye to someone, or even just the possibility of being separated from someone. And I think the important thing to say about all these disorders is that as I'm talking through them, a lot of you might be thinking, well, that's familiar to me. I've got a few phobias, or yeah, I feel a bit panicked sometimes. So do I have a medical problem? Do I need to go and see a doctor? I mean, I think the criteria in a lot of mental health disorders that we use to decide whether it's a problem or not is how much it's impacting your life. So lots of us might get a little bit of social anxiety. We don't feel completely comfortable in certain social situations, but we're still able to leave our house. We're still able to go to work. We're still able to have meaningful interactions with other people in our day-to-day lives. And we self-manage those low-level anxieties. So I think the benchmark for a lot of these categories is if it's impacting your ability to be happy, to function, either at home or at work or in your relationships, or if it's causing you distress, then that's the time to seek help about it. But there will be many, I think what we see as doctors is the tip of the iceberg in terms of these problems. Anxiety disorders are by far the most common mental health disorder that we see. It's estimated that about 50% of people will experience anxiety in a problematic way in their lives, and I think that's probably a huge underestimation. So what does anxiety feel like? I apologize in advance if any of these slides are upsetting or distressing to anyone who's going through this at the moment, and please feel free to mute me or take a break if you need to. We divide the symptoms of anxiety broadly into psychological ones and physical ones. Some of the psychological symptoms are up here. A great way a lot of people describe it to me is that they start to feel stressed about being stressed. So they have this ongoing anticipation and fear. They feel like they're losing control of their feelings or their lives. And then that leads on to other things. I think the worrying part of our brain is always there, but it's supposed to be a small component of our overall thoughts and beliefs. And when it starts to take over, in a lot of the people I see, the worrying part of their brain is using up so much of their bandwidth that they don't have time for anything else, for any other thought processes to be going on. And so they lose the ability to concentrate. They start to avoid or withdraw from certain social situations or work situations, and lose their ability to function. So I see some older patients with anxiety who come to see me and they're worried that they're developing dementia because they can't concentrate. They go to meetings in work and they don't contribute in the way that they did anymore. They've started to doubt themselves. They make lists endlessly because they can't remember anything. And of course, they don't have dementia at all. They have a psychological condition that is not allowing their brain to function properly in other ways. Add to that sleep disturbance, which is a big part of anxiety disorders, and you can quickly see how people end up in very troublesome situations where they're tired, they're stressed, they feel like they've lost control, and they start to stop. They don't want to go out, they don't want to go to work, they don't want to forge new friendships or relationships because they're just worried all the time. There's also some physical symptoms, and these are the ones that are recognizable to a lot of people who don't have generalized anxiety disorder but know what it's like to feel anxious. So that feeling that you get before you go into a job interview or an exam, or before you get up to do some public speaking, little bit of palpitations, sweatiness. Gastro symptoms are a really common one. So we think about a third of the people we see in general practice with gastro symptoms probably have a strong anxiety or psychological component to it. In more extreme situations, people might tremble or breathe very quickly or have very, very tense muscles. And those physical symptoms, when they're ongoing, can be extremely distressing as well. I think, you know, most of us can deal with a little bit of sweatiness or dry mouth before we go into a big interview or a big event, but imagine that happening to you all the time, and it can become extremely tiring. I spoke to a patient a couple of weeks ago who came to see me for the first time with anxiety symptoms, and he'd never had it before, and he played sport to a high level when he was younger, and he described the feeling as what it was like when he was on the sports field, but constantly, that constant hyper alertness, that feeling of, you know, what's going to happen next, where's the next threat or challenge coming from, which in a sporting context he found very exhilarating because it only lasted for 80 or 90 minutes. But in his day-to-day life, he was finding completely exhausting and overwhelming because it never went away. So we talked a little bit about generalized anxiety there and what the symptoms of generalized anxiety are. The other part of this talk is panic attacks. For any of you who've experienced a panic attack, you'll know exactly what I'm talking about here. And a lot of people will describe their panic attacks as the single most frightening or distressing experience of their life that they've ever had to go through. So that gives you an idea of how awful this can be. The thing about panic attacks for a lot of people is that they're very sudden. They seem to come on without warning. So they may be happening in the context of someone who's very stressed and anxious about a particular situation, a recent bereavement or a bullying situation or a confrontation. So there may be a trigger for the anxiety, but there often isn't a trigger for the panic attack. So someone will say to me, it just happened when I was at home watching TV, or I was on my way to work. You know, I've been worried for weeks, but there was no thing that happened in that moment that triggered the panic attack. So they seem to come out of the blue, which is very distressing because you get to the situation where you don't know when they're going to happen. People describe it as an impending sense of doom, sometimes feeling like they're going to have a heart attack or they're going to die. They get overwhelming emotional symptoms of fear and worry. That's then often associated with hyperventilation, so breathing very fast. And the problem when you breathe very fast is it causes knock-on physical symptoms. So you increase the oxygen level in your blood and you decrease the carbon dioxide level, and then that causes things like nausea. It can cause tingling in the fingers and around the mouth. which then makes you breathe even faster, which then makes the symptoms even worse. So panic attacks are a common reason that people wind up in hospital. Patients will say to me, I just didn't know what else to do. So I just had to go and see someone. You know, I knew, even if they knew that it was a panic attack, they knew they weren't about to die. They just didn't know what else to do. The emotions were so overwhelming. So I talked a little bit there about definitions and what anxiety and panic attacks are. Please let me know if you've got any questions on that, but I'm going to move on a little bit more now to what we can do about those things, because many of you will have already known those definitions before I started. A lot of people, in my experience, come to these talks not because they're worried about themselves, but because they're worried about someone close to them, a partner or a child or someone at work. So what do you do if you think someone else is experiencing this? It's not always that it involves professional help. There's a lot of things that you can do yourself or with friends and family to help. I think the first thing is to acknowledge it. You know, often when people come to see me for the first time, they describe feeling better just talking about their problems, even before we've tried to come up with any solutions or treatments. Just having that conversation and saying, look, you seem extremely stressed or anxious at the moment. Can we talk about it? And just breaking the ice there can really be the first step to helping someone access help. We talk a lot, particularly to younger people, about laddering and creating a worry ladder. That involves writing down all the things you're worried about and ranking them in order of importance and how much they worry you. And then essentially what you do is you forget about the stuff that's really, really bad, the 9 out of 10 and the 10 out of 10 worries, you put those to one side and you start with the things that are easier to tackle, the low level worries. And when you've dealt with those, you work up to number 2, then number 3, and it's just a way of separating out some of those anxieties. Techniques like that can help people feel like they're taking back control and taking charge of their anxieties. And a lot of the issues people have in dealing with anxiety is feeling like it controls them rather they control it. And so a lot of these psychological techniques are about taking back that agency and that power over the anxiety. Scheduling worry time can be helpful. So setting aside 20 minutes or half an hour each day to worry about stuff, to feel anxious about stuff. And then putting it back in its box and getting on with your day. That separation, it sounds incredibly simple and you think, gosh, you know, is it really that easy? But little techniques like this can be very helpful for people when the feelings start to bubble up again. I think if you're dealing with it, particularly with a child or a young person, you can model helpful behavior. So, you know, we know that a lot of mental health conditions are helped by having a generally healthy approach to life, eating a healthy diet, exercising regularly, having good social interactions and support networks, spending time with a family, meditating, practicing mindfulness. So you can, you know, particularly for our kids, particularly for our teenagers, they need to learn that behavior from us. And so even if you don't know what all the answers are, you can at least set a good example to the people around you at home. There's a number of apps now, online websites, apps, online resources for people who don't want to seek professional help in person to try themselves online, and that can be useful for things like breathing techniques and meditation. Breathing techniques can be a very important treatment for panic attacks, and meditation in a lot of people is a very effective way of dealing with anxiety. And there's a number of online resources to help you do that. The final sort of self-help method I've got on here, and there are way too many of these to mention, but it's another one I like, is called a grounding technique, and we use that in people. A lot of people who get specific phobias or situational anxieties, so severe exam stress or public speaking or anxiety going into certain social situations. A grounding technique is a way to bring yourself out of your thoughts and back into the reality around you. So we talk about 5, 4, 3, 2, 1. That's what are 5 things you can see? What are 4 things you can hear? What are 3 things you can smell? What are 2 things you can touch? And what's 1 thing you can taste? And you might not be able to think of 5, 4, 3, 2, 1 for all of them, but it's a way of re-engaging with your environment and disconnecting from your thoughts. It's in a way a distraction technique. There are some things that I would avoid saying to a person with anxiety or panic issues. For a lot of people who don't experience those problems, it can be incredibly difficult to imagine how it takes over. So saying things like it's all in your head, pull yourself together, snap out of it. How are you going to deal with any real stressful situations if you can't even deal with this? Those are generally unhealthy things to say to people. If it were that simple, then I wouldn't be giving this talk. None of you would have signed in here. And we would never have to help anyone through an anxiety situation ever again. So I can guarantee you that anyone who's suffering with anxiety issues has already thought of all this stuff and tried it, and it hasn't worked. So even if you can't fully empathize with the situation, try to be understanding. So a common question I get asked by people, friends, family, when I say I'm doing these talks, they say, well, okay, well, what do you actually do? You know, what are the treatments when someone comes to see you with anxiety? They've tried all the online resources, they've tried to help themselves, they're exercising 5 times a week, they've turned into a complete health freak, and it's still not working. So what do they do next? Well, firstly, I ask them a lot of questions. Sit with them sometimes for quite a long time, find out about their lives, their situation, anything that might have brought them to this point. And then we talk about therapies and treatments. And for most people, the mainstay of that is going to be psychological therapy. You can call it counseling, coaching, therapy, psychology, doesn't matter. We're talking about broadly the same areas. And there are a number of psychological therapies that have been proven to help deal with anxiety. It's not just, well, we think this might work. People have studied it. People have shown that it's effective. One of the challenges can be to find the therapist and the type of therapy that works for you, because everyone's a little bit different. And so I will often say to people, if I'm sending them to see a therapist, tell me if it's not working. You know, go and see them a couple of times, give it a try, but don't feel bad about coming back to me and saying, no, you know, that person you sent me to, we don't click, they don't get me, I don't feel like it's getting anywhere. So, you know, I think there's a good therapist out there for everyone. We've just got to find them, and it'll be a different therapist for different people. Cognitive behavioral therapy has for long been the mainstay of treatment for anxiety, and that involves trying to train your brain to behave and approach situations in a different way. So it doesn't make the anxiety-inducing situations or the problems in your lives go away, but it makes you approach them in a different mindset. And I describe that to people often as like having a personal trainer for your brain. Therapists can be incredibly helpful in training and teaching breathing and relaxation techniques, which for someone with panic disorder can be very useful. It's always better if we can stop the panic attack from happening as it's beginning, rather than wading in with medications and things after it's already started. And for some people with things like agoraphobia and specific social phobias, they may try exposure therapy. Exposure therapy is exactly what it says. It's exposing yourself in a controlled and small dose way to the thing that makes you very, very anxious, which is utterly terrifying, but extremely helpful in certain circumstances. But it needs to be done in a controlled environment by someone who knows what they're doing. The other thing I commonly get asked when people come to see me is, well, what about medication? Either they've been seeing a therapist already, or they don't want to see a therapist, or they want to try every possible treatment. And they say, okay, is there a medicine I can take to treat my anxiety? And of course, there are a number of medications. Lots of people don't need them. Lots of people do. My approach with medication is to describe what's available to people and how it works and what the downsides are, and let them have a think about it and make a decision for themselves. When we talk about medication for anxiety, we're talking in two broad categories. There's short-term medication that you can take in the acute situation to make you feel less anxious. It doesn't last very long, but it works very quickly. And those are things like beta blockers, which slow your heart rate down and make you feel a bit more in control and take away that sort of, a lot of those physical symptoms. And anxiolytics, so things like benzodiazepines, like Valium and Xanax. These medications have been around for a long time now. They act relatively quickly to make someone feel very, very calm. There are downsides to these medications, one being that they don't last very long, one being that some of them are addictive, not so much beta blockers, but some of the other ones. And some of them are sedating as well. So they're not always practical to use if you need to be very alert or doing something that requires a lot of focus. But in acute panic situations or in the very short term, they have their role. Then we have longer acting medications. A lot of these are antidepressant medications that seem to work well for anxiety as well. Not all antidepressants do, but some do. The advantage of those is they are longer acting, so you can take one each day and get control of your symptoms over time. They're not addictive, and they generally have fewer side effects. They're not sedating or anything like that. The downside is that they don't work straight away. So it can be very frustrating for someone to start a medication and they have to wait 2, 3, sometimes 4 weeks to notice a difference. So with any medication, you need to know about the upsides and the downsides, but they can be incredibly powerful tools. And you know, I see on a fairly regular basis medication for anxiety completely turn people's lives around. So I don't think, although there's a stigma attached to a lot of mental health medications, I don't think there should be. And I think, like any of these treatments, they have their role in some people. So where do I fit into all these treatments? I think where I would put myself in this diagram is in the middle with you, holding your hand, signposting you in the right direction. So I'm not a psychologist, but I can get you in to see a good one. I'm not a psychiatrist, but I can prescribe the medications you need most of the time. Sometimes people want me to help exclude other physical causes for their symptoms. So they may feel very jittery on edge, but they've actually got a thyroid problem. They may feel very exhausted, but they're actually anemic. So we can run other tests at the same time to just make sure that there's not any underlying physical issue contributing to your anxieties. What I am, I guess, for a lot of people is a safe place to come, a confidential place to come, where they can get their problems off their chest and get advice from someone who isn't involved in their family or their work or their life in any other way, an independent voice, I guess. So a lot of people can talk to their partner or their friends about this, but their friends or their partner might have skin in the game. They may have their own priorities or judgments. And so people want to come to speak to someone who's completely independent about that. So I guess what I'm saying is, if after this talk you think I can help you in any way, then please let me know and come in and see us. It's not just me at Osler Health, of course. I've got great colleagues that are all very experienced. Between us, we speak a bunch of languages as well. So we can hopefully find a doctor that will fit your needs. So I'm going to open it up to questions shortly, but I guess I want the things you take away, the information you take away from this talk to be, firstly, that anxiety is super common. If you're not experiencing it yourself, I guarantee you know someone very close to you who is. It can be very difficult and distressing to cope with on your own without any help. So talk to people about it, talk to friends, come and see a doctor, but don't suffer in silence, because it generally gets worse over time rather than better if you don't address it. And if you're not suffering from any of these issues, then be that person that your friends and family or your colleagues can talk to and confide in. Look out for those around you, and remember, this is not necessarily something that can't be fixed. It might be something you have to manage lifelong, but we can manage it and we can make it better. So on that note, I'll stop talking because you're probably all fed up of this voice. And if any of you have any questions, please feel free to put them into the chat and Susan can read them out.
Yes, we have a few questions, but Dr. Neil, can you stop sharing so that we can see you in one whole?
Of course, yeah. Hang on. Has that worked?
Yes, that's better. Thank you. So we have a few questions here. So this is one of my questions. Like, what is the difference between being nervous and being anxious? Because, some like being in events, before COVID, obviously, we used to do lots of big events. And one of my anxiousness was like, what if no one comes to the event? That's it. Like, I'd be like, I wouldn't be able to sleep at night. I'd just be so worried. And so is that nervousness or is that anxiety?
So yeah, it's a good question. And I think part of the problem stems from the fact that we use anxiety in its medical sense, and we use the word anxiety in day-to-day language as well. And in day-to-day language, anxiousness and nervousness are interchangeable in English anyway. But when I talk about anxiety, I would say the difference is when that feeling takes over. So when you were having those thoughts and feelings, you still got up in the morning, you still went and did the talk, you still performed, and then the feeling was gone afterwards. You got that relief, that wonderful feeling when it's all over. If it gets to the point where you're not doing a good job in your talk, or you can't even get out the house to go and do it, then clearly the stress and the nerves have taken over. And I think a common problem I see in people who come to see me, so a lot of my patients here in Singapore are fairly high performing individuals in their lives. And a lot of people who wind up in careers and jobs at a very high level have got there in a sense because they are worriers. So they have anxious personality traits that make them care about stuff in a certain way. So, if you were at school or university and you didn't really care whether you passed the exam or not, you probably weren't going to pass the exam. If you weren't worried about that job interview, you probably weren't going to perform to your highest level. So we almost select out these people in life and they become successful. And then they get into a role, let's say, the head of Asia Pacific for company X. And the responsibility is overwhelming. And they've now got to worry not just about themselves, but about 200 other people. And the personality traits that maybe once helped them have now become a problem. And so I often say to people, look, we're not trying to change who you are. We're not trying to change you in some kind of weird Zen hippie that never worries about anything, because you wouldn't be able to perform or function. But we need to take you down off that ledge where you're sort of, your anxieties are ruling you rather than you ruling them. So I think Susan, it's about how much impact it's having in your life. Are you coping with it effectively, or is it taking over?
Yeah. A few coffees and a few glasses of wine in the evening time does help. Is that a good thing to have or not?
Yes. I think if you're using alcohol to to deal with mental health issues, that's clearly unhealthy. If you're using it to reward yourself or augment the relaxation in the evening, then fine. And yes, certainly coffees to, if that works for you, there's little harm in doing so. I mean, I think for some people with specific anxieties and phobias, you know, avoidance can be a rational solution. You know, I'm scared of cockroaches. I hate to admit. It's not a huge priority in my life for me to deal with my cockroach fear. I accept it and I run away when I see a cockroach, and I ask someone else to deal with it. And that's fine. That's legitimate. But the problem is, you know, when your worry isn't that, when your phobia is public speaking, and your job involves lots of public speaking, or your worry becomes going to any crowded place, then you know, we need to address that, because you can't have a happy normal life and avoid those things.
Okay. And what about those people that actually, you know, gets the attack then and there? Like, what is the immediate action that they need to take when panic attacks actually come, and how do they relieve it? Like in the movies, you see people like hyperventilating in like a brown paper.
Yeah, exactly. And that's still, you know, that we do, that's something that's still recommended. So the rationale behind that is it's a breathing exercise. So when people panic, they hyperventilate, and the hyperventilation, because of, as I spoke in the talk about the way that changes the sort of oxygen levels in your blood, leads to a state of heightened distress and panic, as well as all the physical symptoms. So by controlling the breathing, we're trying to control the physical symptoms and bring that person back into the real world, if you like, or into a mental state where they're feeling calmer. So breathing into a brown paper bag is essentially you're rebreathing your exhaled carbon dioxide. So the air you're breathing back in from the bag has less oxygen in it, more carbon dioxide. And so it's correcting those abnormalities that have arisen in your blood. That's the theory behind it. Probably what it also does is just slows your breathing down, because it's difficult to breathe quickly into a bag. But what a lot of psychologists will do is, in someone who's experiencing panic attacks, is sort of give them a toolbox of exercises to try in that situation to almost reverse it and get them out. And a lot of those are around breathing techniques. It can be as simple as something as counting your breathing. So being with someone, I think, you know, if you see someone in the street having a panic attack, one of the most helpful things you can do, as well as just being there and reassuring them, is to help them slow their breathing down. So breathe with them.
Right. Okay. And what if they're like almost passing out? I mean, some people do that, right? They're feeling faint.
Yeah, absolutely. So some people feel, either incredibly nauseated, like they're going to vomit, or like they're going to pass out. I mean, definitely sitting them down, cooling them down if they're outside in Singapore is helpful. Often giving them little sips of something to drink will help distract them a little bit, and just talking them through it. You know, you're going to be okay. This is going to pass. Explaining what's going on. You know, in extreme situations, unfortunately, ambulances will be called and doctors will be summoned, but you know, we try to avoid that. When I prescribe medication for panic attacks, that would be some of the short-acting medications that I mentioned in the talk. You know, I would often say, you know, panic attacks, fortunately for most people who get them, aren't super common, but they recognize when one is beginning. So that's when you take your medication, right? It's not medication that I want people to take regularly, but that's the time to take it. And you know that in about 15 minutes, it will have kicked in. And that can be sort of calming in itself, to know that the feeling is going to pass.
Okay. And some people get panic attacks in their adult life. I mean, does that just come randomly, or and will it disappear randomly again?
It can do, yeah. So I mean, I think for some people get panic attacks in adulthood or childhood in the context of stress or anxiety. So there's other stuff going on and the panic attacks are the acute manifestation of that. So you see that happening to people, after incredibly traumatic events or who are going through difficult life situations. And then there are people who get them for no apparent reason, and they feel okay a lot of the other time. And those ones are far less predictable in terms of how long they're going to go on for. I mean, as with anything, prevention is better than the cure. So the goals of the psychological therapy are, as well as giving people a toolbox of things to try when they're having a panic attack, the other thing is to try and put them in a frame of mind where they have fewer or hopefully no panic attacks at all. I mean, that's the ideal.
Right. And you mentioned, set worry time apart, like 20 minutes of your day, trying to kind of confront these thoughts and ideas. I mean, in those 20, 30 minutes, would you write them down? Like, would you write your thoughts down and then deal with it? It's quite hard to just kind of pack it up after 30 minutes, isn't it?
It is. And that's why I think, the act of writing them down is useful, because you can put that list away and come back to it the next day. So yeah, it is. I think the way that works, it is hard to put those worries back in a box. And again, if it were that easy, then we'd all just do it, wouldn't we? But there's something about the scheduling that offers a degree of control to people. So it's not the technique itself. Putting your worries in a box or thinking of 5 things that you can see is not in of itself going to fix anything, but it's a psychological technique to send your brain into a slightly different mode. So it's the scheduling and the control about worry time that helps, rather than the worry time itself, if that makes sense.
Yeah, no, that makes complete sense. Like a lot of people, do journaling in the morning before they go to work and say, right, today, I'm not going to worry about this or that. Is it better to do it in the morning time or evening time?
Generally, I would try and do it. For most people, it's going to be back end of the day.
Yeah.
Particularly if they're working or they think they've got things to do in the day. I mean, everyone's different,
Yeah.
but I would avoid doing it just before you go out to work, and I'd avoid doing it just before you go to sleep. Those are probably the two. And listen, this takes time. Therapy takes time. It's a commitment. And that's, a lot of people say to me, I don't have the time to do all this stuff. Well, you got to try and find it. And I guess that's probably where, a lot of people's preference for medication comes in, is that it's less of a time commitment for people. I mean, we've got to be, that's not a great reason to choose any treatments, but I'm sure a lot of people do make that choice because it's quicker to take a pill than it is to sit with a therapist for an hour once a week or twice a week.
Yeah, I think I'm guilty about that. Give me the solution now. And
yeah.
See how it goes.
And, we have to tailor our treatment to people's priorities and lives. I mean, I prefer medication and therapy not to be a choice. It's not an either or. It's a both. But yeah, for some people, it's not.
And what are the anxiety signs in kids? So I know with my girls, one has had forever tummy aches and headaches, and during COVID with e-learning and stuff, no sleeping. I mean, she couldn't sleep at all. And then, what are the other signs, like a typical sign that you'd say? Oh,
so I think on the physical side in kids, the most common ones are sleep, headache, and abdominal pains, for sure, that I see. On the sort of psychological symptoms, I mean, the symptoms are probably being experienced in the same way, but kids articulate them in different ways depending on their age. And it'll often manifest itself as disruptiveness or aggression or belligerence. These kids will get singled out as naughty kids or troublemakers, or shyness, with social withdrawals often explained away as, oh, she's just shy, she doesn't have many friends. And there's an underlying anxiety cause there. So I guess the difference with adults are probably, we're not always, but we're often better at articulating our symptoms in a way other people can understand. And in kids, they often come out in slightly unusual ways.
Yeah. Okay. And you mentioned some apps. Do you remember what they're called? What are the best apps that you can recommend?
So I'm reluctant on the meditation front because there's just so many now. The original one, when I was still training, Headspace was the original one, the original mindfulness app. But there's just been such a proliferation of them. I mean, essentially, mindfulness and meditation have been around for thousands of years, right? And the mindfulness movement aims to take the original meditation approach that originated in this part of the world and in India and places like that, and take the religion out of it. So to keep the mindfulness meditation bits, but to take out the Buddhism or whatever religion they were trying to remove from it, and that's sort of what came about. There was a book called Finding Peace in a Frantic World, written by two guys out of Oxford, which was the original sort of mindfulness Bible, and now it's a huge thing. I mean, I think on that front, everyone's mindfulness is different. So for me, it's running and playing sport. That's where I escape from stuff. I find it difficult to empty my thoughts in a quiet environment, but it's something you can practice and train yourself to do. But essentially, letting those worries and those anxieties go is the theory behind it, and that's why a lot of people find an escape in, as well as mindfulness, some very intense experiences. Because if they're totally focused in the moment on what they're doing, they're not thinking about their worries anymore. But Headspace for mindfulness, probably the most common website I use. It's not really an app, but the website I refer people to is an Australian one called This Way Up. And they have, it's an online therapy resource. They have courses for anxiety, for stress, for, I think, bereavement, for depression, lots of different things that I can actually refer people to and monitor their progress, or they can sign themselves up for individually. So that's one that I like to use, but there are dozens of these things now.
Yeah. Yes, heaps. So this is another interesting question for you. Let's just go back to medication and how severe the situation might be. So let's say I know somebody's child who is suffering from anxiety. It's so bad that she's talking about, I don't know what the reason for me living, and, talking suicidal on that end as well. Obviously it's very subjective, and everything needs to be catered for the treatment, but she's been seeing sort of like a psychiatrist, but that's not really helping. So what are your thoughts about that?
So what we haven't really talked much about is the overlap between anxiety and depression. And it's not surprising that people who feel like this all the time start to feel depressed about it. I mean, why would you be happy about feeling constantly anxious? So there's a lot of people who have an anxiety disorder also have mixed anxiety and depression. I mean, as a general rule, medication works better the more severe your symptoms are. That doesn't mean we only use it in people with severe symptoms, but people with more severe symptoms notice more of an improvement when they start medication. As another general rule, my threshold for starting medication in children is higher than it would be for an adult. And I think most people would just say that that's common sense. We try and avoid starting anyone on medication, and we particularly try and avoid starting kids on medication. But most of these medications have been studied and tested in children and can be used in children. They require a bit more careful supervision when they start them. But yeah, clearly a child that's already doing psychological therapy and not recovering and having things like suicidal thoughts or severe withdrawal, struggling at school, you've got to think about your other options in that situation, and definitely medication would be one of the main options in that situation. So it's
Yeah.
definitely not a no in kids. It's just we need to really weigh it up, and we need to
Yeah.
talk to kids, talk to mum and dad, and come to a consensus decision.
Absolutely. And we also have a talk about teens and mental health next month. You're coming back to talk about that. And that's more about, mental health and eating disorder and hurting yourself and things like that. So that's going to be an interesting talk as well. Not so jolly, these talks of ours, Dr. Neil,
No,
but
I apologize for hitting you all with this on a Friday morning.
one lady is asking, like, so when she's outside, her heart, starts to beat really fast and she starts sweating when she's in a crowded place. Is that anxiety or a panic attack we're looking at, or just nervous about being outside when people have COVID?
Well, it depends if it's, if it's related to COVID or related to just to the people. I mean, people were suffering with agoraphobia and fears of crowded spaces long before COVID came along. It's not always, the fear of having other people around you isn't always as rational as they might infect me with something. It's just there's people there, and I hate it. Certainly, that sounds like what she's describing. It doesn't sound from her description like it progresses to a panic attack, but there's certainly panic symptoms in there, aren't there? And that's a sort of situation where, that's important to address, because you can't not go outside. There are some specific phobias and anxieties that we can accept and live with, but I don't think that that's one of them for most people. And it's also not practical to take a pill every time you go outside to deal with the anxiety. It might be something you want to try at the start, but really, a psychological approach in that situation, whether it's exposure therapy or cognitive behavioral therapy, but some kind of psychological therapy, I think, would be my recommendation there.
That's totally how I feel when my husband starts talking about skiing. Then my heart starts to like beat really fast and I start to sweat because I don't really like skiing that much. But you know what? I still go and have a great time and just kind of deal with it. But of course, people have different levels of.
Well, that's it. You can ultimately, you could just not go skiing, couldn't you, if it was that bad? So I think the problem arises when it's in a situation that people don't have any choice but to face in their day-to-day lives. That's a real problem. I think the TV or the movie sort of portrayal of phobias is things like arachnophobia. Well, that can be extremely distressing, but for most of us in our day-to-day lives, spiders aren't, enough of a common occurrence that it's going to cripple our ability to function. So, for specific phobias like that, people still might want to address them. Flying's a really common, I mean, probably of the specific phobias, the most common one I see is flight anxiety, which is a huge problem for people who live in Singapore and have to travel around a lot. So, we have different ways to address that, but that's a big one and has a significant impact on people's lives. What if your boss tells you you have to fly 15 times a year for work and you have a panic attack every time you get on a plane?
Yeah, I know. That's exactly what my friend is doing. He kind of sedates himself the whole way to London because he's so scared of flying. I mean, just sitting there before actually taking off just sends him in a frenzy.
It's unfortunately what we have to do in certain situations. And actually, if someone doesn't have to function that highly on the flight itself, then that can be, as long as you're not doing it too frequently, that can be a legitimate approach, is to take something like that. Actually, a lot of airlines run courses for people to help with flight anxiety because they're desperate to get you on that plane. So a lot of the sort of higher end airlines will have resources for people with flight anxiety as well.
Yeah. Oh, okay. This is an interesting question for you. How does OCD fit into anxiety?
Okay. So I deliberately didn't include it when I had my list of different types of anxieties, because it's almost a talk in itself. And so that's why I sort of left it out. But lots of people would, maybe not on that spectrum of anxiety disorders, but certainly along with post-traumatic stress and OCD would put those into the sort of the realm of anxiety disorders. Certainly people with OCD get incredibly anxious about it. So there's the direct link there. I think what's different is, obviously they're different conditions, but our treatment approach can be quite different. So there's some medication overlap, but I have medications that I prefer for OCD than I do for anxiety. And certainly the psychological therapy approaches for OCD can be quite different. I would say the only other thing I'm going to say about OCD, because we could talk for hours about OCD as well, is there might be some people watching this with mild anxiety symptoms that they feel they can manage at home with some of those self-help techniques, and that's okay to try. I think if you think you've got OCD, speak to someone about it. Incredibly difficult to self-manage.
Oh, really?
Yeah. So if you've never seen anyone about it before, just have that conversation.
For example, can you give an example of what type of OCDs are there, like washing your hands constantly? Or
so yeah, I should say that shouldn't I, that OCD stands for obsessive compulsive disorder. And so yeah, the stereotypical one, and it is a common form of the condition, is hygiene obsessions. Again, that's the one that you see portrayed at the movies, the people who can't touch surfaces or compulsively wash their hands or sanitize things. But essentially at the core of OCD is the O. It's obsessions. People have thoughts that they describe as invasive or obtrusive. So they don't want to be thinking about this stuff, and it comes into their frame of mind and takes over. And then that then leads to, in lots of cases, the C, which is compulsive behaviors, ritualistic behaviors, often as a way of controlling the obsessions. So, if I do this, if I wipe everything in the room down, turn around 3 times and say a mantra, then I can go outside and do that thing. These very irrational compulsive behaviors. So but the obsessions aren't always hygiene related. They can be a whole bunch of different things. We see people with harm obsessions, which are incredibly distressing. They're obsessed with thoughts about harming themselves or others, even though they know they're not going to. They just can't get those thoughts out of their head. As I say, we could go down a different road with this, but so there is an overlap for sure. But I personally wouldn't put OCD in with all those anxiety disorders I've mentioned.
Okay. Just going back to your graph there, and you mentioned something about separation anxiety. Just quickly, to all the moms out there, is that normal for young kids, or is this with adults as well, like the separation?
Yeah. So I think that's for most people who don't have separation anxiety, their first experience of something like it will be exactly that. It'll be when they have children, and often when those children first go to kindergarten or nursery. So again, with separation anxiety, it's about its impact. It's fine to be anxious because you're dropping your kid off at kindergarten for the first time. You probably wouldn't be a great parent if you were. And it would also be quite normal for the kid to respond appropriately. I think the difference is, if you can't even go through with the separation because of the anxiety, that's a problem. You need to be able to let go of these people. And the other issue for a lot of people with separation anxiety is the anticipatory symptoms. So yeah, we all get a little bit anxious when we drop our kids off at school, but if you're worrying about it the evening before and you can't sleep, then it's a problem. If it's as you walk up to the gate and it lasts for 5 minutes and then you get on with your day, it's fine. that's an issue you can comfortably deal with yourself.
Yeah. I think I dealt with that with my other daughter who was going, through kindergarten, and she was, very anxious. She had separation anxiety for I think a year. And so we found out when, she could articulate it more and working with a counselor at school that because her grandpa passed away, what if something happened to me? And that's what she was, anxious about.
So addressing that underlying fear.
Yeah.
The way to deal with the separation anxiety. Yeah.
Yeah. Okay. Well, time is running out. So very quickly, could you just, rewind and just give us like the quick 3 tips for handling anxiety when we're out and about and it all of a sudden hits us? Breathe.
So I think get yourself into a safe space. So if it's the situation that's making you anxious, then get away from it. Sit down, have a little bit to drink, breathe. These are panic symptoms really than, generalized anxiety symptoms. And I think, as I keep saying, recognize it in others. These symptoms are a little bit easier to deal with if someone's helping you through it, even if they don't know what they're talking about. Just being there and just telling you it's going to be okay can be enough in the acute situation. If you're going through every day of your life going through this, then ask for help. Go and speak to a therapist, speak to a GP, speak to a friend, but ask someone for help. Because I think there's a lot of guilt people feel about, they feel they shouldn't feel this way. They feel they're a bad person or they're a burden on other people, and that's just not true.
Would you say people shouldn't worry so much?
No, because if it were that easy, I think in our day-to-day lives, modern life has too many worries. We weren't designed to worry about all of the sheer volume of stuff that gets thrown at us. But just saying, don't worry about it, sadly, it works for some people, but those aren't the people who come to see me with anxiety disorder.
My husband is Australian and he always says, "Oh, don't worry about it."
Yeah.
So yeah,
well, I do think the age-old mantras of it'll work itself out and don't worry about what you can't change are truisms, but they're truisms for people who don't have a medical condition.
Yeah. Okay. And if people want to see you, where can they find you?
So we've got 2 clinics. I'm based at Star Vista. The clinic's name is Osler Health International. I'm based at Star Vista, which is not far from Holland Village, next to Buena Vista MRT. And our other clinic is downtown. It's in the Raffles Hotel Arcade. So we're not far away from most people with those 2 locations. Fantastic.
And as I said before earlier, that we're going to have a teen talk and talking about, eating disorder and all, mental health about teens next month. That's going to be on the 22nd, I believe, but I will send you emails about that. Dr. Neil, thank you so much for joining us this morning. I'm quite conscious of time because you have patients very soon. Again, you're a busy guy. Everyone is going to get a fact sheet later. It will be emailed to you. So thank you. And this is also, the recording will be sent to everybody. So if you want to watch it again, just have a look at the slides that Dr. Neil had. And yeah, thank you so much. And please do reach out. If you see me walking on the street and you're having a panic attack, call my name and I'll help you out. Don't worry. So thank you. Thank you, Dr. Neil. Nice to see you again. I'll see you again soon.
Take care, everyone. Have a good day.
Thanks. Bye.
Bye.